So what's really interesting is men are very poor users in general of healthcare, right? So they usually are forced, if they have a female partner, by their female partner to go to the doctor. They have chest pain, they're staying at home. In fact, they often will try to figure out how they can get men to be medical better, uh, to take care of themselves better, which include, seek professional care. The one point where they will self-refer is they have any sexual problems. So, I mean, if, a man can be having chest pain intermittently and he'll just not talk about it, and then he starts failing with his erections and he's at the doctor 2 months later. I mean, that's a subgroup. Some of the men will wait 10 years before they come, or what's even sadder for me is some of the men will see a practitioner who's not really an expert, be thrown a prescription of Viagra, not told, for example, that you have to take it on an empty stomach. It doesn't work, and now they think they're really, nothing's going to work. So, and then it takes them a lot of courage to screw themselves up to come to the doctor again. But the men are very motivated in this particular area. Um, One of the main areas that we see in women's sexual dysfunction is lack of libido, and it's a little harder to have it than it is when you really really want to have sex and you just can't do it. So the motivation are different, and it's also fascinating to me to see what women and men will spend money on. So women, we find as a group, are much more careful with the money that they're spending on their elective healthcare. With the men, it's like, fix me, please. And I mean, not that they don't care what it costs, but it's not as big an issue for them in terms of interfering with the care.